Hi guys, welcome back. In this video we shall be talking about hyperthyroidism and try to understand what is hyperthyroidism, how you develop hyperthyroidism, and we have to understand about the axis, that is how the hormones are released from the hypothalamus, what is happening in the anterior pituitary, what is happening in the thyroid itself. So what is hyperthyroidism? This means you are having more T3, more T4 and less TSH. In hyperthyroidism also we have primary, secondary, tertiary. To understand this better, we shall use the whiteboard. Okay, so to understand this, we have the hypothalamus. We have the hypothalamus. Now from this hypothalamus, there is a hormone release which is known as TRH. Now this will go and act on the anterior pituitary. From anterior pituitary, it will release another hormone that is known as TSH. Now this TSH will act in thyroid. Thyroid gland. From this thyroid gland, we are going to release T3 T4. Okay, these are the two hormones that have been released from thyroid. Okay, now we are talking of hyperthyroidism. This means there is increased T3, increased T4. Okay, increased T3 and increased T4. But you have to understand, whenever these things will happen, it will give a negative feedback to anterior pituitary and hypothalamus. That means whenever the T3 and T4 level are increased, it will give a negative feedback to the anterior pituitary and the hypothalamus to say, okay, don't need to produce more. Do not release TRH or do not release TSH. That we are already having T3 and T4 in excess amount or in the normal amount. That is the balance. Again, if the T3 and T4 hormones are released, they themselves are going to give a positive feedback to anterior pituitary and hypothalamus. In order to say that we are having less T3 and T4, we need to increase the amount. How it will increase? Hypothalamus will give signal to anterior pituitary. How it gives signal? By TRH. Now, how this anterior pituitary is going to give the signal to thyroid gland? It is going to give by TSH. Okay. So remember, whenever T3 and T4 level will go down, TSH level will go up. And whenever T3, T4 levels are up, TSH level will go down. Now, this is known as primary hyperthyroidism or hypothyroidism. Now we are talking about hyperthyroidism. This means T3, T4 levels are more, TSH level is down, because obviously our body will not want to have excess. Now the condition is that this is primary hyperthyroidism. T3, T4 is increased, TSH is reduced. Now in secondary hyperthyroidism, what will happen? Let's say we are having a tumor in the anterior pituitary. If you are having tumor in the anterior pituitary, it is going to release more TSH. More TSH means more T3 and more T4, right? So how we will know it is a secondary hyperthyroidism? Increase TSH, increase T3, increase T4. This is how we will know that this is secondary hyperthyroidism. Now, how do we know it's a tertiary hyperthyroidism? Tertiary problem. If the TRH is increased, TSH is increased, T3 is increased, T4 is increased. In endocrine, if we are having a problem in the target organ, we will say it primary. Now, if we are having a problem in the anterior pituitary, we will say it secondary. If we are having a problem in the hypothalamus, we will say it tertiary. Okay. So if you see, if there's any problem in the anterior pituitary, if it is overacting, so overacting means it will produce more TSH. More TSH will make more stimulation to the thyroid gland. More stimulation to thyroid gland will cause you more T3 and T4. Okay. Again, same goes with the hypothalamus also. If there's problem, that is tumor is there, if the hypothalamus is producing more TRH, it will stimulate more anterior pituitary. If anterior pituitary is more stimulated, more TSH, more stimulation to the thyroid gland, that means more T3, T4. Same thing will be like this also. If there is hypothyroidism, if there is a case of hypothyroidism, T3 is less, T4 is less. If T3 is less, T4 4 is less, but if you see the thyroid stimulating hormone, it will be more. This means you are having a primary. Same thing goes, let's say we are having an anterior pituitary, that means anterior pituitary is not working. Let's say it is not working. What will happen not working? Then this TSH will also go down. What will happen in that case? TSH will go down. Okay, along with this, no TSH means no stimulation of thyroid hormone, no stimulation of thyroid hormone means no T3, no T4. So even T3 will be less, T4 will be less. Okay, so this TSH help us to identify where is the problem. If there is some abnormality in the TSH, we know that the problem is in the anterior pituitary. If there is some problem in the TRH, we know the problem is in hypothalamus. So that is what you have to understand about hyperthyroidism, hypothyroidism. We'll make another video about hyperthyroidism. Now, hypothyroidism. So this is what you have to understand. Now let us try to understand what is the actual problem. How will you know that you are having hyperthyroidism? Remember, whenever you are having hyperthyroidism, you will be having one only abnormality, that is, you will be having weight loss. Along with this, but you will be having increased appetite. You will be eating like crazy. You will be increasing your appetite, but you will be losing your weight. Okay, then you will be more restlessness. Okay, you will be having intolerance to heat. Like anytime heat, it's very painful for you. Like even if you're sitting in the AC, you'll be saying someone, hey, increase the AC. Okay, along with this, you'll be sweating. Along with this, you'll be having tachycardia. That means your heart rate will be up. You will be having tremors in your hand. Okay, along with this, you will be always in a state of nervous. Your basal metabolic rate will go up. Okay, you'll be having palpitation. That means you'll be able to hear your heartbeat. Now, along with this, if you say what is the main cause of hyperthyroidism, the main cause of hyperthyroidism is grave disease. Now, what is a grave disease? Grave disease means you are having hyperthyroidism. Along with this, you are having a goiter. Along with this, you are having a proptosis of your eyelid. Okay, sorry, eye. How do you know you're having proptosis? This means whenever you see your eye, that black part. We are actually saying about black part because inside is the iris and above is the cornea. Now, cornea is very transparent. We cannot see the cornea. Okay, so cornea is covered by the upper eyelid by 2 mm. Now, in case, let's say, if there's proptosis, now the 2 mm cover of my upper eyelid is covering my cornea 2 mm. If there's proptosis, then my eyelid will, you can see my cornea like this. Okay, you can't see the cornea, you can see the structure behind the cornea, that is your iris. Okay, so as I told you, the main problem is grave disease. What is actually happening in grave disease? You have to understand one thing. In grave disease, it is an autoimmune disease. Okay, it's an autoimmune disease in which you're producing a antibody. This is known as LATS. Now, okay, you're producing an hormone which is known as LATS. This means long-acting thyroid stimulating antibodies. Okay, long-acting thyroid stimulating antibodies. Okay. Now, remember this LATS is very similar structurally to TSH. So, a person who is having grave disease, this LATH will go and act here. Okay, and it will stimulate the thyroid gland more and more. So the T3 will go up, T4 will go up, and now the main culprit here is that will the TSH go up? No, we will not be able to see the TSH. It will be very, very much reduced or undetected. Okay, or undetected. You can't see it. What will happen? I'll just recollect it here again. Whenever you are having LATS, this is released in if you are having grave disease. Now this LATS is very similar structurally to thyroid stimulating hormone. Now what will this LATS will do? Will go and come here in this part and will keep on stimulating the thyroid gland. So the T3 level will go up, T4 level will go up. Right now, if you do a test of this thyroid stimulating hormone, if you want to see what is the level of thyroid stimulating hormone, you won't be able to see the level. It will be very, very, very less reduced, or you might not be able to detect it. Why? Because of the negative feedback. Because this thyroid stimulating hormone is replaced by LATS. Okay, so whenever you are stimulating this T3 and T4, this T3 and T4 will give a negative feedback to anterior pituitary to release less TSH. Okay. So it will give so much negative feedback that this TSH level will be maybe undetected or maybe very much reduced. So that is about grave disease. Grave disease also you will have hyperthyroidism. In grave disease you will have hyperthyroidism, and due to the antibodies, that is the LATX antibody, these antibodies are very structurally similar to thyroid stimulating hormones. So this will go and keep on stimulating the thyroid in order to produce more T3 and more T4. Remember, I told you T3 and T4, if it is increased, it will give a negative feedback to the anterior pituitary and hypothalamus, saying, hey, stop, we don't need any more. Now this T3 and T4 will be so much increased that it is going to give so much negative feedback, then the TSH level will be so much reduced, maybe sometimes you might not able to detect it. So this TSH level will tell you is you are having problem in the primary or in the secondary. Okay, so if you are having a problem in the primary, this TSH level and T3 T4 level will be inverse. If you are having secondary problem, there will be similarities. Okay, what I mean by similarities means, if you are having a tumor in the anterior pituitary, if you are having a tumor in the anterior, pituitary, it is going to release more TSH. More TSH means more T3 T4. You are having hypothyroidism. That means what kind of hypothyroidism? You are having secondary, because your problem is in the anterior pituitary. Again, grave disease, we are releasing LATS. LATS is structurally similar to TSH. It is still going to attack here and is going to release more T3 and T4. But due to this negative feedback, it is going to go to the anterior pituitary saying, hey man, I don't need any more. Then it will stop this TSH, and this TSH level will go down and down and down. Okay, maybe to that extent that you might not be able to register the value of TSH. So this is about grave disease. Now, what is the treatment? Now, what is the treatment? Treatment is surgical treatment. Okay, you have medical treatment, but main very good treatment is surgical treatment. Let's say you're having primary hyperthyroidism. That means T3, T4 levels are increased, TSH level is decreased. That means you'll try to remove the thyroid gland. Okay. Now, if you're having a secondary hyperthyroidism, this means you're having a problem in the anterior pituitary. How do you know you are having secondary hyperthyroidism? If you see the TSH level is also increased and T3, T4 levels are also increased. Okay. At that time, you are going to remove the anterior pituitary. Okay. That time you are going to remove the anterior pituitary. So that's how you can manage, that's how the treatment will rely. If you are having problem in the thyroid or you're having problem in the anterior pituitary. In secondary hyperthyroidism, you are having the problem in the anterior pituitary. Even if you release the thyroid, remove the thyroid, it's wrong. You have to remove the anterior pituitary and you have to remove the culprit person. Okay. So that was about hyperthyroidism, and the treatment is very good. Treatment is surgical. Along with this, you have to take some medication. As I told you, the symptoms will be, remember, the person will be eating crazy. He'll be eating a lot, but still he'll be very tired. Very thin, lean and thin. His metabolic rate will go up. Okay. Along with this, he will be having sweating. Okay. Along with this, he will be having palpitation. He'll be able to hear his heartbeat. Along with this, he will be having increased heart rate. He will be having tremors. He will be always in not calm. He will be like fidgeting. Okay. Along with this, whenever you go and meet someone's hand or shake his hand and feet, it will be very sweaty. Okay, it will be very sweaty. Okay, so they sometimes avoid to shake hands. Along with this, if you see a person who is having hyperthyroidism, he will be having heat intolerance. This means even if he's getting a little bit warm also, even he is sitting under the fan or sitting inside the AC, he'll still say, please increase the AC, I'm still feeling hot. Okay, that's how you can know the person is having hyperthyroidism. But remember, in hyperthyroidism, only exception here is that the person will lose weight, lean and thin, and everything will go up. Okay, everything in his body will go up. That was about hyperthyroidism, and next topic we'll talk about hypothyroidism. Okay, thank you.